I have a question for you. Is there a health fact you grew up your whole life knowing, only to find out later in life that was actually incorrect? Like, remember growing up, you were told, if you don't wear a jacket when you're out in the cold, you're going to get sick. A lot of us grew up hearing that, only to find out being cold doesn't directly make you sick. Germs do. And these misconceptions are very common, even amongst us as healthcare professionals. In this video, I'm going to highlight a few common healthcare myths as nurses we frequently hear from patients out in the field. And if you stick around till the end, I'll give you one medical myth that is actually not a myth, but is actually true. Hi, I'm Fairchild, a registered nurse with over 15 years, and I created this channel to discuss health and wellness in a simple, clear, and honest way without medical jargon or fear-based advice. This is a no judgment zone. If this sounds good to you, please like and subscribe as we continue to discuss more topics like this. All right, let's get into this in no particular order. Myth number 1, if it were serious, I'd feel really sick. This is one of the biggest myths. In reality, many serious conditions start quietly. People often say, I didn't want to bother anyone, or I'd feel worse if it were serious. As nurses, we know that symptoms don't always show up loud and dramatic. Feeling okay doesn't always mean everything is fine, and feeling awful doesn't always mean something dangerous. This is why yearly checkups with your primary physician are important to catch such scenarios. Number 2, high blood pressure always has symptoms. This surprises a lot of people. Most of the time, high blood pressure causes no symptoms at all. No headache, no dizziness, nothing obvious. You can feel totally fine and still have high blood pressure. Myth number 3, antibiotics fix most sicknesses. This is a big one. Antibiotics only work for bacterial infections. They do not work for colds, flu, sore throats, many sinus infections. So when a doctor says you don't need antibiotics, that doesn't mean they aren't listening. It usually means they're trying to protect you from meds you do not need. Taking antibiotics unnecessarily can cause you to build a resistance to them. As a result, they may end up not working when a time comes when you do need them. Myth number 4, pain always means something is really wrong. Pain can be scary, but pain doesn't always mean danger. Pain can come from muscle strain, inflammation, stress, old injuries flaring up. As nurses, we look at, is this a new pain? Is it getting worse? Is it different from your normal pain? Pain is information, not always an emergency. Myth number 5, if I rest long enough, it will go away. Rest is important, but rest doesn't fix everything. Some symptoms do improve with rest. Others need care or follow-up. Nurses pay attention to when symptoms keep coming back, slowly get worse, or start affecting daily life. Listening to your body doesn't just mean resting. It also means knowing when to ask for help. And finally, like I said in the beginning, a medical myth that is actually true. You can have diarrhea and still be constipated. This sounds impossible, but it's true. You can be constipated and still have diarrhea. Here's how that happens. Constipation doesn't just mean not going to the bathroom. It can also mean hard stool stuck in the bowel. When the hard stool gets stuck, liquid can leak around it. So it looks like diarrhea, but the real problem is constipation underneath. Nurses call this overflow diarrhea. And that's it, 5 myths and a bonus. If this helped you, consider subscribing. And if you've heard a health myth that confused you, drop it in the comments. I'm glad you're here, and when health information feels confusing, it's okay to just ask a nurse.